think we're ready, right? Okay. Hi, everyone. My name is Elizabeth Gonzalez. I'm with the biology department at South Texas College. Today, we brought to you an event that's free and virtual, and we are extremely excited to be talking about something that is relevant to our area and our community, which is HIV in South Texas, as well as along the Texas-Mexico border, and how COVID-19 does affect this as well. We have two speakers for you that are going to be sharing a lot of informative information for you. And so let me go ahead and introduce them to you. Their names are Armando Molina and Oscar Lopez. Before we do that, we'd like to make sure that you all are aware that we do have a YouTube channel. If you could subscribe to it, because we are going to keep providing speaker series events for you, and that you can get the latest from us. So if you could subscribe to our YouTube channel, and then this video is also being recorded. So if you would like to share it with someone, or if you would like to look at it further, you can go ahead and rewatch the video. So our two speakers today, Armando and Oscar, let me go ahead and talk to you about them a little bit. So Armando is from Brownsville. He serves marginalized populations through education, testing, and counseling. He began working for Valley AIDS Council in 2007, conducting outreach and providing testing in high-risk communities. He was trained to address substance use and mental health issues within Latino communities. And then as CLEAR coordinator, he worked with HIV-positive patients to improve their quality of life by addressing gender identity issues, addiction, and mental health. In the year 2016, he received the official Texas PrEP Pioneer Award due to his HIV prevention efforts and involvement in establishing the PrEP program within the Valley AIDS Council. Armando is currently the public health advocate for Valley AIDS Council, where he is working to bring comprehensive sexual education back into public schools. And later throughout this session, you're going to go ahead and see a live HIV test happening. And our next presenter is Oscar Lopez. He's the CEO and National Policy Director for Poderosos, a national advocacy and capacity building organization based on the US-Mexican border, with a focus on improving the wellness of the Latinx community. Born in Matamoros and smuggled into the United States, he first began working for the Valley AIDS Council as on its first employees in 1988. He then moved to Austin and created his own program for homeless and runaway youth, serving over 2,000 youth per month before becoming the director of Inform SIDA, the only Latino-specific HIV organization, before moving to Washington, D.C. to develop HIV treatment adherence conferences across the US for the National Minority AIDS Council. He was then recruited by the Federal Office of Minority Health to develop their new capacity building programs for minority serving organizations. In New York City, while serving as the US Program Director for Engender Health, he introduced male reproductive health services to family planning clinics nationwide. And as the policy director of the Latino Commission on AIDS, he worked closely with congressional members to pass HIV-related legislation. He returned home to the Valley in 2012 and held several management positions at Valley AIDS Council before becoming the national policy director, where he ensured that no national plans regarding the wellness of Latinos and HIV were ever developed without the input of the Rio Grande Valley. He founded Poderosos in December 2019 to address the needs of marginalized communities no one else wanted to address. He is one of 5 Latinos that meets regularly with the heads of the CDC, making sure the needs of Latinos are not overlooked. In the last 2 years, his media work with Univision has garnered the Team 5 News Emmys. And without further ado, we'd like to introduce you to our speakers.
Thank you very much. Sorry, our bios, mine especially, was so long, but it gives you the understanding of just how very, very old I am. I'm Oscar Lopez, and this is?
I'm Armando Molina.
And we're really glad you're here with us. And we're really impressed that South Texas College decided to do this because this is not a topic that a lot of organizations, a lot of schools, a lot of entities want to discuss. But unfortunately, it's really impacting the young people, especially in our community, the marginalized communities that we're going to talk about a little bit further. And so we're really impressed with STC and the biology department for doing this because it will be life-changing, I promise you that.
So what I'm going to do is I'm going to bring up the PowerPoint and share our screen so we can get started. Here we go.
And by the way, if you hear any yapping in the background, I have two cute little dogs, but they can be a little loud.
Okay, so today's presentation is addressing disparities that make the border community more vulnerable to HIV and COVID-19. So at the beginning of this presentation, it's going to be a little basic about HIV and stage 3 HIV, and then it's going to get more in depth as long as further along the presentation goes. So first off, what we always like to do is talk about what does HIV stand for, right? So the definitions and meaning of HIV is human immunodeficiency virus. I know it sounds pretty basic, but actually it's very important to know that only humans can get HIV and can transmit it to other humans. Okay, so it can't come from mosquitoes or other kind of animals like monkeys or cats or anything like that you might hear out there. I get those questions a lot when we're doing outreach, but only humans can get HIV and can transmit it to other humans. And another important thing to know is that a lot of people think that only the LGBTQ community gets HIV, but it's a human virus. So it really involves the whole community.
In 1981, when we had the first cases of HIV in the United States, the first person to be diagnosed with what would later become called HIV was a gay male in New York City. And because of that, there was a lot of stigma put on the gay community that they had this disease that everybody had to be careful for and with. And it began decades and decades worth of homophobia legislation that has really hurt that community in the long run. But what was interesting is that at the exact same time that HIV was spreading across the United States, particularly around gay and bisexual men and other men who have sex with men but consider themselves straight, and yes, they're out there. In Africa and African nations, what was happening was the exact opposite. It was spreading within heterosexuals and passing from mother to child. So unfortunately, because in the United States, it was considered a gay disease, it took President Reagan 4 out of his 8 years in office before he even uttered the words HIV, which might sound familiar to some of you who've been waiting for someone to take COVID seriously. But that said, we all know now that it infects humans, it attacks the immune system, which is what protects us against colds and viruses and disease. And it is a virus itself. So.
And then we have AIDS. It means acquired to develop over a period of time. It could take years before anybody gets into the AIDS stage or the stage 3 HIV. Usually when somebody has HIV, it's usually asymptomatic. So if somebody was to have HIV, they usually don't show any symptoms or any signs. So somebody can have HIV and feel as healthy as they always did all their life. However, once they get to the AIDS stage or stage 3 HIV, that's when they start noticing symptoms and start getting sick. So that can take years before anybody, of years of having HIV before even knowing. And that is a big issue that we're having in the Latinx population. And you're going to see that further in this presentation. One of the health disparities is that people, the Latinx population, don't get preventative care. And they really only go to the emergency room because they don't have a PCP usually. They go to the emergency room when they're really, really sick, can't get out of bed. However, when it comes to HIV and AIDS, that usually means that they're in the AIDS stage and they probably had it for years and had probably transmitted the virus to other people during that time. The I and the D is the same thing. Immunodeficiency breaks down the immune system, the very thing that keeps us healthy, like Oscar said. And then S is for syndrome. That means a lot of signs, a lot of things happening in the body at once. So it's attacking the body, a lot of signs and symptoms.
About 4 years ago, we stopped using the word AIDS to describe what Armando has called a stage 3 HIV. And the reason for that was twofold. One is that AIDS had such a tremendous stigma to it that the discrimination that people living with HIV got was that of what you would read in a Bible, for example, and what was done to lepers. In the early days especially, and I can say this from having lived through it, in the early days of AIDS, it was not unheard of for mothers and fathers to kick their children out of their home, to have them eat off of paper plates with plastic spoons and knives and forks because they didn't want them using their cutlery, not allowing them to hold their nieces and nephews for fear that they would contract it that way. So the stigma has not gone away. Most recently, there was a family whose son became diagnosed with HIV. And even though they were educated, that fear was there, and the comadres and the people in the community would tell them things that weren't true, but that they believed, to the point where the family created a shower stall made out of, what do you call that wood? Plywood, with a water hose over it so that he could shower outside so he wouldn't be using their bathroom. So AIDS has been removed. We don't talk about it as AIDS. It's HIV stage 3. And the other thing about that is that we now have medications that are so fantastic that when someone has HIV and they take their meds, there's no reason why they should ever develop stage 3 or what was known as AIDS. So in effect, we have eradicated AIDS because now, as long as you take your medications regularly as prescribed, you should never get sick from this disease.
So before we go any further, it's important to know that HIV is found in the blood, semen, vaginal fluid, rectal fluid, and breast milk. Okay, so this is where HIV is found. So if anybody was to come into contact, maybe through unprotected sex or by sharing needles with these body fluids, that is the way of transmission. So the most common methods, like I just explained, is unprotected sex, and that is unprotected oral, vaginal, and anal sex. Unprotected anal sex is the highest risk towards HIV, and then it's vaginal, and then the lowest risk towards HIV is oral.
And to make something very clear, whenever we talk about anal sex, people automatically start thinking gay, that's something that gay men do. And first and foremost, not all gay men do that. And I know plenty of women who do. So I just want to be clear that all of those ways to transmit are options for anybody, heterosexual or homosexual. And we just need to be clear that anybody who's having unprotected sex with anyone else is potentially at risk.
Absolutely. And the other most common method or high risk method is sharing needles with infected persons. So if somebody was to share needles with drug injection, like injecting drugs or homemade tattoos or homemade piercings, anything that has to do with sharing needles, they put themselves or they're vulnerable towards HIV, hepatitis C, those kinds of viruses.
It's also important to note that HIV, when it's exposed to air, dies. It immediately is no longer something that can infect you. But within the syringe, because there's no air in there, within the needle and the syringe, HIV can live there. And when, again, it's reused with somebody else, it could be a couple of days later, it still poses a risk.
Absolutely. And then the almost eliminated risk factors for HIV transmissions is transmission from mother to fetus or mother to baby. Nowadays, it's less than 1% of a baby being born with HIV, even if the mother is positive for HIV. And then infection from blood products. I don't know how long it's been. It's been many years now.
Since 1988.
Since 1988, where they checked the bloods for HIV, syphilis, hepatitis C, all those kinds of viruses or infections to make sure that people are not getting contaminated blood.
If I can say something about the transmission from mother to child, while that's becoming more and more rare, the region where it still exists is the South. and it routinely occurs within Latino and African American families. Oftentimes, unfortunately, we have men who step out on their partners with men or with women, contract HIV. They don't think they're at risk for it because perhaps they were the penetrative partner. They're the ones that were penetrating someone else, or because they felt that they knew the person they were with. They become infected, and unknowingly, they go back and transmit it to their spouses. Now, Latinos and African Americans are the two groups that have least amount of insurance coverage, health insurance coverage. So that means that they have to seek out government-run, county-run prenatal programs to get examined, to check on the baby's health, and to walk them through the birthing process. But many people don't want to come forward and access those services, especially our undocumented immigrant and migrant populations. So it's not unheard of in the Valley, where we've had children still, even though there's no reason for it anymore, because if the mother was HIV positive and she took medication, she can actually give birth to an HIV negative baby. But if you don't know you have HIV, then the risk is there to pass it on to your child. Even today, 20, 30 years into this epidemic.
Okay, so here we have a video. It's very brief, it's about 2 minutes long. It's going to show how HIV affects the body. So here we go. We're going to share this video with y'all.
If you have HIV, there's a good chance you want to know what's going on inside your body. You may have searched online. You may have asked someone. You may have even watched a video or two. Now, if you're confused, stay right here, because I'm breaking it down for you. First, know this. HIV is a virus. The letters stand for human immunodeficiency virus. Now, I know what you're thinking. Immuno what? But this is a good place to start, because we need to talk about your immune system. Your immune system protects you from disease and helps keep you healthy. It does this with the help of some really important cells called CD4 cells. You may have heard them called T cells. Inside your body are lots of CD4 cells. They are the fighter cells, the defenders against germs. They help keep you from getting sick. But get this, when HIV enters the body, it goes right after these defender cells. It finds a CD4 cell, invades it, and just takes over. If that doesn't sound good, well, it isn't. The CD4 cell is not helping you anymore. It's working for HIV. The infected cell becomes like a factory, making new HIV particles, and these virus particles go on to invade other CD4 cells. That's what HIV does. It multiplies itself inside your body. Now, while this is happening, you may look completely fine. You may feel fine, but the virus is still inside, working away, causing harm to the body. That's the trick HIV plays. Before you even know it, the number of CD4 cells in your body is going down, and the number of virus particles is going up. That's why HIV is an immunodeficiency virus. Your immune system has less fighting power to keep you from getting sick. This can lead to serious infections, to cancer, and of course, to AIDS. The thing is, this doesn't have to happen. You can take care of your health. Now, there is no cure for HIV, but there are many treatments available now to help stop the virus. Remember how I told you HIV works to multiply itself inside the body? Well, HIV treatment stops this from happening. The virus factories get shut down. The CD4 cells go back to protecting. The number of CD4 cells could even go up. That's why it's important to talk to your healthcare provider and start treatment before you feel sick. Waiting just gives HIV more time to harm your body. So don't let HIV build a virus-making factory out of your cells. No way. Take care of yourself and stop the virus.
Okay, so we're going to...
So some of those things that he was saying may sound familiar to you, because it's similar to the way coronavirus is impacting people's lives by attacking their bodies. And again, the most vulnerable people are the ones that are more susceptible to both illnesses. So the healthier you are, the better your immune system, the better you are to fight HIV and COVID as well. We covered, I think, all of that in the presentation. We did. If anybody has questions along the way, don't forget to submit them, and we're going to be going over all those questions a little bit later.
Yeah, so we talked about how HIV is transmitted. However, HIV is not transmitted by air or water. It's not transmitted by saliva, sweat, tears, or kissing, insects or pets, or sharing toilets, foods, or drinks.
So there's a stranger out there you really want a French kiss with, go for it. You may get mono, but you won't get HIV. Well, you might get coronavirus too.
That's something to watch out
Yeah.
for now. And so that means you can safely share a desk, dishes, a hug, a toilet, or a handshake with someone who has HIV. So that means working with somebody, living with somebody, going to school with somebody that has HIV, having casual contact with them. There's no way of getting it that way. As we explained before, somebody would have to have unprotected sex with the person that has HIV or sharing needles in order to get HIV. So
for the 7th consecutive year, the Rio Grande Valley saw an average of about 250 new HIV positive clients every year. And this figure is from 2018, but we checked, and in 2019, there were also about 255 people. And as we near the end of 2020, it's also at about 250. Nationally, 10% of HIV positive Latinos die within 12 months of receiving an HIV diagnosis because they waited too long to get tested. These Latinos that are dying are people who never got tested, who thought they were invincible, who didn't understand the need to practice safer sex, or something was done to them without their permission, but they also didn't get checked. And they carried the virus in their body for multiple years. By the time they went and got tested, it was because they were sick or they were in an emergency room. And this happens a lot to Latinos because, again, we're the most uninsured population in the United States. So when you don't have insurance, when you're afraid of the migra, when you are scared of the institutions that provide these services, you don't go near them. It's only when you're on your deathbed do you get rolled in and you get an HIV test done, because almost everybody who goes to the hospital gets one. That's when these people are finding out that they're HIV positive. They're already in stage 3, or what was known in the past as AIDS, and they tend not to live more than a year. We get to them really quickly. We start them on meds. We help them with housing. We help them with support. We help their spouses understand what's happened, their children, etc. But it's this thing where they wait 12 months. I mean, wait so many years that ends up killing them in the long run. Can you show me for a second? Yeah. I want to tell you a quick story. Can we hold on? Give me 1 second. We're going to go back to our screen for 1 second.
I would love to share.
I'll do it. Yeah. So I'll just talk over the slide. Several years ago, while I was working here in the Valley, I had I wouldn't call it fortune or misfortune. I had the opportunity to talk to a woman who was in her 70s. And she came in trembling, a little scared, not sure why she was at the Valley AIDS Council. But her husband had just died at one of the hospitals. And she was sent to us without much information, which is, I mean, kind of the way things work in the Valley sometimes, unfortunately. Sent to us, and we were given the task of explaining to her what happened to her husband and that she perhaps had contracted the virus as well. So her grandchildren drove her to our organization. They didn't know why they were there either, but while we were waiting to see her, they were looking at all the HIV brochures, the flyers, the posters, and they got a sick feeling in their stomach. We called grandma in, held her while she cried about the just recent death. It was just hours before that her husband had died, and then asked her for permission to do an HIV test on her. And immediately it came back HIV positive. We told her, like we tell anybody else who tests positive with one of the instant tests, that we will draw their blood. It takes about 7 days to send that out to the lab in Austin at the state health department. They send it back with results. And that confirms that somebody is definitely HIV positive, because we always do 2 tests on any individual that tests positive just for confirmation. It's very rare that we get a false positive, but it's still done. So we gave her information and held her while she cried. And then she asked us to explain to her grandchildren what was happening, which we did. And after that, she asked us to talk to their children, their parents, which we did. But it was very, very hard for her to cope with the fact that not only has she just had her husband die on her. But what had he been up to all these years behind her back? Because this came out of nowhere to her. Latina women routinely contract HIV, and there's no reason for it, because with condoms, with PrEP, which you'll learn about in a little bit, a medication you can take to prevent from contracting this, like birth control for HIV, if you will. With those things and with the knowledge and information that's out there, there's no reason for anyone to contract this, much less pass it on to their partners. And the danger with this is that when a Latina's pregnant and she's HIV positive, again, if she doesn't know it, she passes it on to her child. We have had several cases in the last few years of men who continue to say and deny that they're not the ones who passed on the virus to their wives. They don't know what the wife did, but she got HIV and she gave it to him and she gave it to the baby. And they deny that they had any culpability with it. The challenge there is not only the emotion, the abuse that she's enduring, but many times the woman has found out that she's positive only when she gave birth and they tested the baby and the baby's positive as well. The problem there is that these same men who refuse to admit to any behaviors or any wrongdoings then stand in the way of women getting access to their own healthcare and in the way of children getting their own healthcare. We've actually had to get court orders in some cases to have a judge give us permission, forcing the dad to allow us onto their property to give a child their dose of medication on a daily basis, as opposed to mom or dad doing it for them, because doing it and giving that child that medicine reminds the father too much of what he did and his culpability. So very important for women to get checked annually. We recommend that anybody who's sexually active get tested at least every 6 months. And if you're a very popular person, then every 3 months. But male or female, get tested. But if you're female, especially get tested for yourself. And if you're of childbearing age, get tested for a potential baby, unborn child.
Okay, so in South Texas, we average 5 new HIV diagnosed infections every week. Every 7 days, we identify 1 new HIV positive youth between the ages of 13 to 24. That's 50 plus new infections in 2018 among our youth. And 76% of HIV infections in the Valley are male. So this is why it's so important that we do speak to our young folks, our adolescents, or even younger than that, to teach them about comprehensive sexual health, because they are at a vulnerable age to get STIs and HIV or even unplanned pregnancies. So it's very important that when we're doing prevention work, that we do talk to young folks at an early age.
I've been teaching comprehensive sex education for 35 years, before computers existed, if you will. And I can tell you that I've taught kindergarten children about sexuality, but not about penetration, penis, vagina, but about their bodies and about good touches, bad touches, stranger danger. All those things should be discussed at 5 years of age. As they get into 6th and 7th grade, they learn more about their bodies, what they're going to be going through when they hit puberty. By 4th grade, young girls should be understanding of what a menstrual cycle is, because it's not unheard of that by that age, some young girls do have a menstrual cycle and they're scared to death because no one's explained to them about the bleeding and the process and the monthly cramps or any of that. So instead, we allow our youth to go through shock and learn the hard way, as opposed to doing comprehensive sex ed. And the main reason this is happening is because prior to us having only, I'll be honest, I have no political affiliations, but prior to George Bush Jr. becoming our governor, we had comprehensive sex education, K through 12, in every school district in the state of Texas. I taught every youth in Brownsville, Harlingen, McAllen, San Benito, etc. back then. When George Bush came into office, he removed comprehensive sex education. And the caveat was that sex education could be taught by teachers only, not outside organizations, and that it did not have to be science-based and it did not have to be factual. So with that in mind, and the fact that people could lose their jobs if they said the wrong thing during one of these educational sessions, no teacher picks up the curriculum provided by the state of Texas. And no child for the last 18 years has had sex education within a public health system in the state of Texas, which is extremely unfortunate.
I would say even 22 years.
22 years, you're right,
Yeah.
correct.
And you know what? Not only are the young people taking this in strides on their own, but they're getting misinformation from their peers, like their friends or their primas, and they're teaching them things that makes them more vulnerable of getting STIs or unplanned pregnancies or even HIV.
And when schools don't teach this and then parents don't teach it, what ends up happening in this day and age with computers, internet, phones, etc., is young people, children will search out porn. And once you discover that, your worldview of what sex is very skewed, because it is not commonplace for a woman to take on 10 male partners. It is not commonplace for a woman to be penetrated by 2 penises at the same time. It is not commonplace to do all sorts of things that you will see and easily find, as many of you know, online. But we have so many young children who ask us about pornography because that's been their teaching. And so to get that child to then understand the value of a one-on-one relationship, about intimacy and the importance of building trust and relationship and love within that relationship is so hard when they associate sex with what they see online. So if you're a parent or a young adult, and you have siblings that maybe need this conversation, please have it with them, because I'm not against pornography by any means. But I'm pro teaching children what they need to know to protect themselves, protect others, and to know what's right and wrong, and how to be careful.
Yeah, it's absolutely important. And parents speaking to their children about this, because not only do they learn the right information from them, but it opens up that communication between parent and child. Okay, so when you see this picture up here, it's the map of the United States, right? However, it's showing you the percentage of new HIV diagnoses in the US and dependent areas by region in 2018. So if you look at the far west, where California's at, Nevada, Washington State, all that, in Colorado, they had 19.2% of new HIV infections in 2018. If you look at the upper Midwest, 13%, upper East Coast, New York, Philadelphia, 15%. But if you look at the South, it's 52%. That's more than half of all new HIV diagnoses in 2018 is in the South.
And the number 1 state for HIV infections is Florida, followed by the state of Texas. So yay, we're number 2. And if we keep at it, we can become number 1. So keep doing it. But let's talk a little bit about the South, if we could.
Yes, of course.
So the reason why we have so many cases of HIV in the South is that it is the poorest region in the United States, with the least amount of formal education, with most youth dropping out before they exit out of high school. It's where we have incredible unemployment rates, where people don't have, again, primary care providers or health insurance. And there's a lot of rural communities within these regions as well, with limited, mass transit to get to services that they might need. So there's a lot of things, one on top of the other. But the number 1 thing that impacts the HIV rates in the South is racism, and the general attitude that Latinos and African Americans don't need this information, don't need these services. And that, in fact, has caused an explosion of HIV rates that are phenomenal, insanely phenomenal in the South. Even when Latinos and African Americans want this information, want to get tested, want the services, many times they don't exist in their communities. And when they do exist, it's often at an organization that might be considered gay or gay friendly, but that's enough to draw our people away from it because they don't want that label. It's almost as bad as the label of having AIDS. And that willingness to go and forego and not access those services has cost the South tremendously.
Well said. And Oscar brought up a lot of these points when we're talking about factors driving the HIV epidemic in the South. He had mentioned poverty, racial discrimination, low health literacy, no health insurance, domestic violence, lack of resources, limited technology, no transportation, reduced medical and social services, cultural factors, cultural norms is something that Oscar was talking about, with HIV stigma, substance abuse disorders, homophobia. And, you know, when we're talking about stigma, has been associated with lower delayed access to care or prevention due to perceived discrimination. And really, Oscar had just mentioned that, you know, people don't even want to come in our building because they don't want to be labeled as gay or part of the LGBTQ plus population. But, you know, when we're talking about health disparities and the marginalized, it even magnifies more when we're talking about undocumented immigrants and the LGBTQ plus population. So a lot of the things that Oscar had just mentioned before I even got into this slide, he hit it right on the nose. And when we're talking about HIV among Latinos or the Latinx population in specific, you know, HIV disproportionately affects Latino communities in the United States. More than 100,000 Latinos with stage 3 HIV, which is formerly known as AIDS, have died since the start of the epidemic. Prevention efforts previously led to promised declines in HIV among Latinos. However, progress has stalled in recent years, with new infections beginning to rise, particularly among Latino, gay, and bisexual men.
Let me just, I mean, the cultural factors, you know, the fact that machismo might create a reluctance to access or acknowledgement to access, a reluctance to acknowledge sensitive yet risky behaviors such as male-to-male sexual contact. We have Marianismo, which is where we put women in a certain box and say, this is what you're supposed to be like, be a lady, do this, do that, don't do this. On top of that, we have our faith and religion, which is a great savior, a driver for many of us doing well, but not when it's used against you or against certain populations. And that is also a challenge for Latino communities. Many Catholic and other churches and faith-based organizations have worked with us all over the country and do great HIV missions and programs. But too often, the messages that they hear within those buildings are that, again, man shall not lay with a man, woman shall not lay with a woman, and the discrimination begins to happen as well. So there's a lot of things to consider as to why Latinos are so heavily impacted. But when Armando was talking about Latino, gay, and bisexual men, where there's been a new infection rising there, of all the groups in the United States, every single one of them has plateaued, where the infection rates have stopped at a certain level, or they've dipped dramatically within our white populations, white gay men, white women, white youth, etc. African-American men plateaued, African-American women plateaued, African-American youth plateaued. Latinos of all sorts have seen increases, but the #1 group becoming infected with HIV right now in the United States in hugely disproportionate numbers are Latino, gay, and bisexual men and men who have sex with men. And again, those men who have sex with men are the ones who are living heterosexual lives, but is still engaging on occasion with sex with other men. And I don't want to have anyone leave today thinking like, oh, damn those men, it's their fault. They're the ones hurting women. It is society and culture and our families that put people in boxes and don't allow them to be truly who they are, to admit to their desires and wants and needs. And if we would just be more open about human sexuality and the norms and how normal it is to have these needs, desires, and wants, there'd be less infections, less disease, less people dying. And it's up on us, those of you who are watching, who are Latinos, who have family members who are Latinos, who may be married to Latino now, you have a Latino child. Congratulations, brown is beautiful. But please, we have to stop the stigma, we have to stop the discrimination, we have to start conversing about HIV with everybody, because grandma can get it and so can your kid. On that note, we're going to show you one of my favorite little programs. I've had the pleasure of meeting all of these actors, and the young man in the leather jacket on the armrest of the sofa is from Roma, Texas. But they are the cast of a telenovela called Sin Vergüenza. We're going to play episode 1 of it, and at the end, we're going to give you the links to see episode 2, 3, and 4. because they made 2 per year. These novelas have won multiple awards. And I had the great pleasure of going to LA for their premiere as the MC and telling the crowd about how we use this in the Rio Grande Valley to educate people. It is a fantastic novela, so hang in here with us. We're going to show it to you. And it may cause you to maybe submit some questions in for us in a little bit.
Order up.
Thanks, Papi. It's the last one of the day.
You need me to stick around, Dad?
¿Por qué? ¿Vas a salir con esa bola de...
They're my friends, Papa. Okay, listen, you asked me to fill in for Orlando, and I did.
You know, your sister works every day. Your mother works. Your grandmother
Cesar,
works.
he is in law school, for God's sake. Be proud of him.
Yeah.
My mom always wanted me to marry a lawyer.
And I always wanted to marry a doctor.
First year intern, but we'll get there.
Good to see you, mijo.
You know you're proud of him too, Senor Salazar.
You okay?
Yeah.
Well, I'm off to the senior center. It's bingo night and I'm feeling lucky.
Ooh, lucky, because Mom says Senor Rodriguez is gonna be there.
Oh, maybe you'll get really lucky, Grandma.
Yeah.
Cállense, los dos. At least you treat me with a little respect.
Come on, Grandma. You know Grandpa would have wanted you to be happy.
Yeah.
That's bad, huh?
Yeah. We can drive you if you want, Grandma.
Gracias, mijo. Let me grab my purse.
Okay. Later, Pops. Bye, Mom.
Bye, mijo. Cuídate.
Bye.
Are you still going out tonight?
Yeah. Just gonna meet the guys for a drink or two.
Mija, ¿qué pasa?
Cesar is going out again tonight. Mama, I think he's cheating on me.
Ay, mijita. It's not always easy, but marriage is forever.
Buenas.
Cristina! Hector's here!
Hello. It's locked.
Pásale, mijo. My future son-in-law.
Hiya, Pa.
Yeah, my favorite father-in-law.
Now, this is a man you can settle down with, eh?
Huh? Did you get that?
Yeah, we'll see.
No se adelanten. First she finishes school, and then we'll see about settling down.
Ay, se hace rogar, hombre. ¿Eh? ¿Qué pasó?
Nice, nice.
Good. Eh? So how's the towing business? How's your father?
Business is good. Bunch of dummies getting too many tickets. And a bunch of dummies that don't make their monthly payment. Better for us, huh?
We'll see.
Ours is good.
Yeah.
Ours is really good. Getting a little slow, though.
Yeah, well.
Are you? Where? Huh?
Oh,
Huh?
what?
No le saque.
See? Eh? There's no shame in working for a living. Not everybody needs a fancy college degree. Hmm?
Good for nothing. All right, sure. Baby, let's go. Thank you.
Ándale. Ándale, mijo, se cuida, ¿eh? Regresan temprano.
Mom, you don't look too good. Are you sure you don't want me to stay?
I'm fine. I'm fine, mija. It's just been a long day. Go on.
Are you sure?
Yes, go have fun, okay? Bye. See you later. And you be careful.
Yo también ya me voy. Me voy. Don't wait up for me.
B1. B1.
Just looked at you.
No, he didn't.
Oh, yes, he did. He just did it again.
Nora, cállate, por favor. You're making me lose track.
Ay, mujer, por favor, lose track. You'd rather win $100 at bingo than meet a single available future ex-husband?
Nora, por favor, I'm not interested. Okay, and besides, I think he could hear us.
Ay, mujer, been a widow for 10 years. Enough already. It's time to meet someone.
G60.
Bingo! Bingo! I won! I won!
Bingo, bingo. Is that really all you're interested in? Esther.
Christina. What now?
You know what?
No, I don't know what. Did you forget to take the pill or something? Is it the time of the month?
No. No, it's none of that. I think... I think we should use one of these.
Look, we never used one before. You're on the pill, right?
Yeah, but the pill only protects me from getting pregnant.
What are you trying to say? Come on. You know you're the only one for me. The only one that matters?
Excuse me, señorita. May I join you?
Oh, well, it's my comadre. She's.
I think she's over there, sitting with my compadre, Guillermo.
Well, then, yes, please. Sit down.
You're quite good at this.
Good at what?
Bingo.
Bingo. Yes, thank you.
I have been a widower for 6 years now.
It's been 10 for me.
I was wondering if... would you perhaps like to have dinner with me tonight?
Dinner with you tonight. Okay, that would be nice.
I know a place you would love. You like Italian, right?
Mommy?
I'm in here.
Are you feeling better?
Yeah, I'm feeling okay, baby. What's wrong with you? What did Hector do?
Nothing. I just know you don't like him.
Oh, baby, come here. It's not that, mija. I just don't want to see you get stuck. The choices we make stay with us. Yeah. I'm gonna be okay.
Yeah.
It's gonna be okay.
This place is so much fun. The music is awesome.
I don't know. It doesn't really seem like our kind of vibe.
Oh, I like it, and you like me, so come on. Come on, it'll be fun.
Okay. Oh, Tejano music? Really? Gosh.
So, what do you think?
It's different.
Yeah, but fun though, right?
Yeah.
In the fridge! Hello? It's me. Yes, I know it's you. What happened last night? You just disappeared.
I'm here.
Oh, yes, and I'm here, silly.
I mean, I'm here with him.
Oh my gosh! Mujer, congratulations. How was it? Was it better than bingo? Cuéntame todo.
We had some dinner and then a couple of drinks.
Uh-huh.
And one thing led to another.
Uh-huh,
And then it happened. Mujer, finally. I'm so happy for you. You use protection, right? What do you think? I'm gonna get pregnant?
Ay, mujer, in your dreams. Protection from other things.
What other things?
STDs, sexually transmitted diseases, hello. Chlamydia, gonorrhea, syphilis, HIV.
Ay, chica, what have I done?
Okay, Mrs. Salazar, the doctor will be here to see you soon.
Thank you.
Okay, Mrs. Salazar, that wasn't too bad, was it? You were right to come in. If you're pregnant, that could affect your blood pressure, which is probably why you fainted.
Yeah.
But we'll know in a few minutes. I also want to screen for STDs and HIV as well.
HIV? But I haven't been with anybody but my husband for 25 years.
I understand. It's just standard procedure. We can find out today if you want.
Oh, I'd like that.
Great.
Hey.
Listen, I'm late for work. I have to open today.
Where's your mom? Hey, look, about last night.
I don't want to talk about last night.
Are you seeing other guys?
Really? Look, don't turn this around on me, okay? I'm just trying to protect myself.
STDs are for crack whores.
You just don't get it. You don't get anything.
What? What don't I get?
It's bad enough that you're screwing around on me, but don't treat me like I'm an idiot.
You don't trust me.
I don't know. Should I?
Well, look, if you don't know the answer to that, maybe we should just call this off.
Then let's call it off.
No.
Quítate. Quítate.
Okay, Mrs. Salazar, we have your test results. You are pregnant.
Okay. There's more. Isn't there?
Hey. We have to talk.
We have nothing to talk about.
No. You're gonna talk to me. Okay, all of these years, all of the comments and the insults, and you're just like me.
No, I'm not. Soy hombre. I'm your father, for Christ's
It's
sake.
all a lie, Dad. Okay, you've been living a lie. Don't you understand that?
I'm so ashamed, mijo. I'm so ashamed.
Being gay isn't something to be ashamed of. Mama, you look terrible. Are you okay?
Where have you been?
I was out.
I've been trying to reach you all night.
Bueno, mujer, what do you want me to say? My battery, my cell phone battery died, and I forgot that.
Who was it? Huh? Who else have you been with?
You told her?
No, I haven't said anything.
Told me what? Oh, mijo. You knew this?
¿Qué es lo que está pasando aquí?
Mamá, este condenado, este sinvergüenza. Who is she?
You don't know what you're talking about.
No, Cesar, you're gonna listen to me.
No, I'm asking you a question.
What's your
Sister, I
question
need
again?
to know. Please tell me, who is she? Who is she? Mama. Me dio SIDA. SIDA. And I'm pregnant. Dios mío.
Papi, how could you?
¿Qué te pasa? Is it true?
I'm sorry.
This is all my fault, mija. I'm sorry, Adriana.
Said if you had only told me and been honest with me from the beginning.
Es mi culpa, mija. Perdóname.
Mama.
Perdóname.
You tested HIV positive, but until you get your blood work back, we won't know if it progressed to AIDS.
What's the difference?
There's a huge difference that way. HIV is a treatable disease, and it can take many years before someone with HIV develops AIDS.
Yeah, he's right. Now, the first thing we need to do is get you tested.
Don't worry, Papi. I'll go with you. I'll get tested too.
Yo también.
You gonna be okay?
There are treatments, precautions. You need more information, and we gotta be honest with each other, you know? We'll just take one step at a time.
Okay. You want to put us on percent? I'm not here to start. Okay. So welcome back. I hope you enjoyed that telenovela. That was season 1 of Sin Vergüenza. And again, we're going to give you the links to season 2, 3, and 4 that you can watch at your leisure. I found that when I showed it to my mother and my grandmother years ago, they were shocked at all the right moments. They laughed at all the right moments, and they learned a lot from it. And so this video works with all sorts of generations, and it's available online for anybody to use. What I find very interesting about it is that at the end of this one episode, you realize that almost everybody in that room, in that family, was at risk for HIV. The daughter, because she allowed herself to be talked out of using protection. The grandmother, because she was a little suelta after her bingo party. The mother, because of her husband's activities, which were on the down low, nobody knew about them. And at this point, the son hasn't told anybody about the father. The father doesn't know his status, but we can make some assumptions based on what they've shared about the mother that we don't know for sure. And the only people who were being careful were the 2 gay men by using PrEP, knowing their status. And I point this out because I want people not to walk away thinking this is a gay disease. This disease is disproportionately impacting gay, bisexual, and men who have sex with men, but not because we're ignorant and not because we deserve it, but because there's so much pressure on Latino, gay, bi men to not be who they truly are, to not love themselves, to feel, that they're not of value, that they don't value themselves. And when you don't value yourself, then you're not going to take care of yourself, because why should you?
Yeah, and just as you mentioned, if a person's on the down low or living a double life, well then, I know Oscar had mentioned earlier in the presentation that somebody could use condoms or get on PrEP or get tested to take precautions, right? However, when somebody's on the down low, they're not going to carry condoms with them because they're in a so-called monogamous relationship of a heterosexual relationship. So why would they carry condoms with them, right? So right there, they're already making themselves vulnerable for sexually transmitted infections like HIV. And then then they won't get on PrEP either, because why would they get on PrEP if they're in a monogamous heterosexual relationship? And also they won't get tested for HIV. If a person is on the down low or living a double life or a secret life, they won't even step into our clinic because it might throw them off, letting people know that they're part of that community.
Okay, so we're going to move forward. And I wanted to show you this map because this is the border between Texas and Mexico. We have El Paso up on the top. It's called the El Paso HSDA, which means it's El Paso and all smaller little communities that surround El Paso. Then you have Uvalde, then you have Laredo, Corpus up on top, which doesn't border anything, so they're just for show. And Brownsville, HDCA, which includes all three counties, Willacy, Hidalgo, and Cameron County. So you can see that in 2018, and please know that the data is always about 1 to 2 years behind, but projections, when you start seeing it climb, will basically tell you that it's gonna get worse before it gets better. The Brownsville HSDA in 2018 had 127 new infections. And as Armando said, last year they had 250, and this year 250 more. In El Paso, they had 134. Uvalde had only 8, Corpus Christi 48, Laredo 39. I believe that there's more infections in those regions, but I think the El Paso organizations and the Valley organizations do an exceptional job, and I no longer work for them, so I can say it and mean it. I think they do an exceptional job at getting people tested and getting them tested early and into care. Now, between El Paso, Uvalde, Laredo, and Brownsville and Corpus, there were 356 new HIV diagnoses. And the reason this is important is if you look below that, you see that Arkansas, the state of Arkansas, had 290 new diagnoses. Oklahoma had 302 new diagnosed HIV cases, and Kentucky had 349. In all three cases, the border of Texas and Mexico, our border, the borderlands, had more HIV cases than each of those states. And yet each of those states received more funding for HIV prevention than our entire border combined. And you know, you can say, okay, well, that sounds racist, or why would they do that? That's a really good question. And I don't have an answer for you other than this is why I work with legislators to get the answers, to right the wrongs. But this is why it's also so important that we get out and vote and register and have our voices heard and advocate for each other in our communities, because it's horrific to think that we are valued less than the people in Arkansas, Oklahoma, and Kentucky when we are showing that we're at greater risk for HIV. Now, I'm going to talk about, hold on, I'm not sure what I'm going to talk about. Oh, no. Okay, now I'm going to talk about meth, crystal meth, Tina. Sometimes they call it ice. Crystal meth is a drug that has been around for decades, that has become hugely popular over the last 20 years. I was recently invited onto an international panel to speak about the health of Latino, gay, and bisexual men on behalf of the United States and Mexico. There was a speaker from Lebanon and one from Pakistan. And then our participants were 120 something people from all over the globe who were asking questions and interacting with us. But I was the first one to say that the #1 cause of HIV infections within gay and bisexual men in the United States and in Mexico is crystal meth. Once I said that, Lebanon said the same thing, Pakistan said the same thing, Norway said the same thing, England, Canada, etc. Which surprised me because I knew it was an issue here and in England and a few other countries. But the fact that in Lebanon and Pakistan, crystal meth is not only readily available and being abused, but it's also leading to new HIV infections. For those of you who don't know anything about crystal meth, I can speak of this from a place of knowledge because I'm in recovery from crystal meth. I was exposed to it in New York City, and I'll tell you what it does. You can smoke it, you can crush it up and snort it like you would cocaine with a straw, but it will kill your nose. You can put Hi, can you hear us? Can you hear us? Can you all hear us?
Are we good?
Hi, yes, we can hear you.
Okay, great.
Our apologies. I'm not sure what happened. If you've ever seen the movie Gremlins, that's possible. But since we're on the board, it's Gremelinos or something, but my apologies. I was just saying that crystal meth is the leading cause of new HIV rates that are skyrocketing within Latino, gay, bisexual men. And you can say, pues, ¿quién les manda? It's their fault. That's what they get for doing the drugs or whatever. But you have to ask yourself, how much self-hatred is there? How much low self-esteem is there that you need to medicate yourself in this way to be free with who you are? I can only speak for myself. I've been out and proud since I was 18. My family loves me. They love my husband. I've been with him for 33 years. We did it because everybody else was doing it. And before you knew it, it's a very, very addictive drug. I still functioned because you don't sleep, so you can work 24/7. But it's really hard on your body. And it's hard on your relationships because your friends, aren't around to hang out with you because all you're doing is dancing or going out and doing things that, aren't traditional for a lot of folks. So I caution people about this drug, but I also say that be aware of it because in the Valley, it's very prevalent. It's available in liquid as it comes across the liquid form as it comes across the bridge. It's being actually made here in the Valley as well. And many of it stays here because it comes through the Valley all the way to New York and LA. But if you hear of anyone doing crystal meth, be aware of that. They need some real education about the consequences. Most of the people that I know who dabbled with crystal meth and have lost control at some point or another. They've lost their jobs. They have lost their families. Oftentimes they've been arrested. And then they get bailed out, but then they don't show up to their hearings. So now there's warrants out for their arrests. When they try and get their lives back together a year or two later, or whatever the case may be, it's so hard because, again, you have to get your ID. You now are a felon. You have a criminal record. Every time you apply for a job, they ask questions of that nature. So the kind of jobs you can get are labor, are, waiting tables, cleaning, and that's not something that will generate a lot of income. And at the same time, there are tremendous amounts of meth overdoses occurring currently throughout the United States and here in the South. And a big reason for that is COVID-19. It has forced people to stay in their homes, to not have a lot of, relationships and communication and in-person contact with your friends, your neighbors, your family, your lovers. And that has an effect on people's brains. And the way some of them are coping is with alcohol or crystal meth. And the downside of that is the addictiveness of the drug and how hard it'll be to shake it off afterwards. And that we actually at Poderosos, if you go to our website, poderosos.org, you'll see a variety of posters that we created for social media. They were targeted to the gay and trans communities because that's who we were funded to work with. But we were trying to remind people that, hey, you live in a multi-generational household. Your abuelita is there. If you're gonna go out and be a cabron and have a good time and party and not practice social distancing, not protect yourself, you have to understand that when you come home, you're infecting other people, your mother, your dad, your grandma. And because Latinos have so many comorbidities between diabetes and cancer and high blood pressure, et cetera, we're the group that's suffering the most right now regarding COVID-19. We're going to talk about that in just a second. I have a little timer that just went off. I'm told to remind everybody that if you have any questions, to please submit them because we're going to sort through them, organize them, and get to them towards the end, I promise. In 2019, a study funded by the National Institute of Drug Abuse surveyed clinicians, nonprofits, and AIDS service organizations, among others, and found that crystal meth was the substance contributing most to negative outcomes in HIV viral load suppression among HIV positive individuals. So not only is it causing people to zero convert, that's what we call it when you become HIV positive, you zero convert, but once they're positive, if they're still using the drug or if they then are turned on to the drug once they're HIV positive, it's the #1 cause of them falling out of care or not taking their meds regularly as they should. And when that happens, their viral suppression, the ability to suppress the amount of virus in their body, is lessened. And when you have lost control of the suppression, now you're possibly able to infect other people. So it's very important that anybody living with HIV be extra wary of this drug because of its addictive nature and because, again, it acts counteractive to what you're trying to do, which is to save your life, not infect anybody else, and stay as healthy as long as possible. In Texas, I wanted to show you this thing about negative impacts of HIV outcomes. They looked at the population level negative impact of various drugs: methamphetamine use, alcohol use disorder, cocaine, opioid use, binge drinking, and cannabis. And you can see on the bottom arrow, no negative impact on this population and highest possible negative impact. And the one that scored highest, big surprise, was methamphetamine use disorder. And again, it's just an example of, yes, cocaine is bad. Yes, it's recreational for some folks. I have done cocaine when I was growing up. I have drunk. I've never done opioids. I haven't binge drink, but cannabis, yes, sir. But you have to be really, really careful when you start experimenting with drugs that are more risky, more addictive, et cetera. And methamphetamine is at the top of that list. In 2015, a review paper basically showed that the rates of HIV infection based on studies with animal models showed that the methamphetamine users with HIV frequently had higher viral loads than non-users because of their drug use and because they had fallen out of care. So not only are people infectious, but their viral loads are higher than those of others who've fallen out of care but aren't using meth. So again, the higher the viral load, the greater the chance to pass that on to somebody through needles, through unprotected sex, etc. A February 2020 study finds that meth enhances HIV replication as well. So this study came out that also showed that not only does HIV cause you to fall out of care, impacts your immune system, but it actually helps the virus, the actual virus that lives in you, replicate faster and in greater quantity. So again, if you know anybody who uses crystal meth and is HIV positive, please support them in getting off of it, weaning off. If you know somebody who's experimenting with crystal meth, it leads in many cases to HIV, regardless of whether you're gay, straight, bi, curious. It is the riskiest drug in terms of HIV that we know of.
Okay, so like what we explained earlier, what is AIDS, formerly known as AIDS, HIV stage 3. So what is that? I'm going to show you a little picture here with blood vials. So if you see that blood vial on the very left, that is somebody that is negative for HIV. That's their T cells or CD4 cells in their blood. So those blue cells are their CD4. And then maybe they put themselves at risk. Maybe they shared some needles and now they're HIV positive. And so you can see the acute HIV infection, a lot of HIV cells within the CD4 cells, that's stage 1 HIV. However, years later, maybe months and years later, somebody having HIV, now it's a chronic HIV infection, which is stage 2. And you could actually see that the blood has less HIV cells and a little bit more CD4 cells. And that's the body's response, antibodies trying to fight off the HIV infection. However, since HIV does attack the immune system and it actually attacks the CD4 cells itself, it's going to lose that battle and the person's going to end up at stage 3 HIV, which is formerly known as AIDS. So if you look at that blood vial at the very right, you can see that the person's blood there is full of HIV cells instead of CD4 cells. And that's when a person usually starts seeing signs and symptoms of being sick or ill.
So antiretroviral therapy, that's a mouthful, antiretroviral therapy. I'll say that 3 times quickly. What does it do? Basically, we call it ART, and it's daily use of a combination of HIV medicines to treat HIV. In the past, people with HIV, back in the 80s, when I first came onto the scene and started working in this field, people had to take 10, 12, 13 pills a day. Now, in many cases, it's down to 3, and in many cases, it's down to 1. 1 medication a day, 3 max for most folks, protects them by improving their immune system, reduces the amount of HIV in their body, prevents HIV from advancing to AIDS or stage 3, and reduces the risk of transmission. Again, when somebody takes this medication routinely and doesn't stop, their viral load will get to the point where they cannot infect anybody else. And they want to have bareback, condomless sex, more power to them. And do they need to tell their partners? That's up to them. It's their body, as long as they're undetectable, which means again, there's no detecting the virus in their body.
Well, one of the important, like Oscar just said, being undetectable, in order for a person to get there, they really have to be adherent to their medication, meaning they have to take it every day as prescribed from their doctor. And so if you see this viral here, you can see that the person's blood there has a lot of HIV. Once they take their medication every day as prescribed, they can get to an undetectable level, which means if a person's undetectable, that means they're untransmittable. So even if they are positive for HIV, but they're undetectable, they can even have unprotected sex with somebody and not transmit the virus.
And U equals U is a campaign that you'll sometimes see in posters and t-shirts. And basically, again, means undetectable equals untransmittable. And it's very much been something that has been embraced by the HIV positive community because they're tired of feeling like a criminal, like they've done something wrong. And this basically says, I might have HIV, but you'll never get it from me.
That's right. And then
so PrEP. You want to talk about PrEP, or do you want to do the test?
Sure. Let's do the test.
Okay. So how do we get the camera back on?
Okay.
So we're going to do a live HIV test, and I'm going to be the guinea pig. In the old days, they would draw blood out of your arm, and you'd be like, "Ay, chihuahuas, that hurts." That's no longer the case. It would take 2 weeks in the past to get your results. Again, that's no longer the case. We now have a variety of HIV tests that are Insti tests. The first one that we're going to show you is actually called Insti. The results come back in 1 minute, and all it takes is a prick of the finger, and he'll draw a little bit of blood for me, and he'll put it in a container. We'll show you the whole process. After he puts the blood in a little container with fluid and shakes it, he pours it into a cylinder. I'll show you the cylinder in a second. He pours it into this little container, and that's coming from vial number 1, which would have my blood and the fluid that's in there. It gets absorbed by the membrane that's in there, and then after it's absorbed, he'll pour in vial number 2, which helps process the blood, and then vial number 3 will tell us very much like a pregnancy test. If there's 1 dot, then I'm HIV negative. If there's 2 dots, then I've been exposed to HIV. And both Armando and I have had to give these kind of results to so many people. And it is heartbreaking because they walk in wanting to get tested. They're nervous that they've done something that put them at risk. The vast majority of the time, like 9 out of 10 times, they're negative. Everybody leaves happy, and hopefully they've learned a little bit. They walk out with condoms. They hear about PrEP. Maybe we enroll them in the PrEP program so they can take a pill and not contract HIV. But 1 out of 10 comes back positive. And we've been there as people have fallen on the floor, fainted, cried, convinced that they're going to be hated by their families, that they'll be disowned. That almost never, ever happens. But it's the reaction they have because of the stigma of this disease. And that's the thing we're asking all of you all to do. Today on World AIDS Day, talk about COVID and how Latinos are more at risk for it. Talk about HIV and talk about how Latinos are more at risk for it. And have those conversations with people so that the next time a kid worries that he has HIV, he's not going to get worried about going to get tested because maybe his mom will take him and she'll support him regardless of the results. But it's up to us in the Valley to change the way this disease is viewed. And I've been here since 2012, and the change is happening but damn, are we slow people? I really, really need you to get behind this because it's costing people their lives. And too many innocent babies, women who didn't know what was happening, men who didn't know what was going to happen, have been exposed to a disease that they didn't have to be. On that note.
Okay, so I'm gonna get your finger. I'm gonna clean this finger with an alcohol swab. Okay. Due to time, we usually don't dry it with a cotton ball, but in this case I am. So I got a little lancet right here. Doesn't hurt as much as the other lancets. This one's made out of ceramic instead of metal. Poke them. And I feel this little stick up with blood.
Will you show it to me here?
Yeah.
And trust me, I mean, I felt no pain. I'm very butch and masculine, but it didn't feel anything at all.
Okay, so once I
Can you
get
it
this,
by the white space so they can see it? There, that's my blood.
and what I'm gonna do is I'm gonna pour it right in vial 1, as so. There you go.
And you can show it against the white of the wall so it's more visible. There you go. So that's vial number 1. And he covers it up and will shake it gently and pour it into the membrane, which I will hold for him. It is my blood after all.
And I'm gonna pour it right in here.
And I would show it to you, but if I tilt it, it'll spill. It's getting absorbed by the membrane. I'll show it to you in just 1 second. Okay, so it's gone.
It's been
Now,
absorbed.
We pour in vial number 2, which helps process the blood. And it's also getting absorbed slowly.
Yeah, this one's gonna absorb slower because it already absorbed blood.
Now, when you go in to get tested, don't think, oh, I'll be in and out of here in 1 minute. The test is 1 minute. But counseling you and unpacking your baggage and just how crazy you are and like learning everything we can about you, that can take a while. So come in prepared for 30, 40 minutes. And depending on the results, could be a little longer, but there, that's been absorbed.
And here's what is it, vial number 3?
Yeah, vial number 3.
It's going in there.
So I can already tell by looking from my angle that there's one little blue dot showing up. And sometimes you see that, and then before you know it, there's a second blue dot. If 2 blue dots show up, the news isn't great. But I would anticipate as a gay male who is on PrEP, pre-exposure prophylaxis, a pill that I take daily so that I will not contract HIV, just like women take birth control. This helps me feel pretty confident that the results will be negative. And I'm about to show you. Come on, little thing. He forgot to give me a Band-Aid. I'm bleeding all over the place. Okay, so it's been absorbed. And if you can see, I think you can see it there. There's one little blue dot. That means, and some blood there, sorry. That means I'm HIV negative. And I would get counseling about how to stay negative. You know, what have I done well? Did I have a slip up, etc. And everybody who takes PrEP gets tested every 3 months. And they see their doctor every 3 months because medications, you know, whether it's aspirin or something else, all have side effects. And all medications can be hard on your liver. So we want to make sure that your liver and your kidneys are doing well. If you go to a doctor, like I did when I first came to the Valley from New York, I was on PrEP. I went to my doctor and she gave me a year's supply of PrEP with no blood work or anything. I never went back to her ever again. Descovy is the one I take. The other one is called Truvada. This one is gentler on the liver and the kidneys, even though I never had problems with the other one. And it looks like this. Tiny little blue pill, and it's my time of day. So cheers, here's to no HIV. Simple as that. I take it every day, along with my vitamins, etc. And that's one thing I don't ever have to worry about. As a gay male, as a Latino, as somebody in a low-income community who might be at higher risk for HIV, not me, not today.
Yeah, just in case you didn't see the dot clear enough, I cleaned off the blood there. You can see that one dot, that means he's negative for HIV. If there was 2 dots, another dot underneath, then that would be preliminary positive. And you could actually see the 2 dots on the packaging on the membrane there.
And I'm going to tell you a little bit about PEP since we're here, and to also save us some time and we can get to Q&A in just a little bit. PEP is post-exposure prophylaxis. You may have heard of the morning after pill, Plan B. These are pills that women have taken for several years now when they've had an unintentional or a misstep sexual experience and they didn't use protection and they are fine that moment, but the next moment, the next morning or a couple hours later, they're freaked out about, oh my gosh, I don't want to get pregnant. I can't have another baby. I can barely support this, whatever the case may be. These are accessible to women over the counter, and they take them and they can have some peace of mind that they have control over their own body. PEP is similar. If you ever go to a party and someone slips you something and you pass out and you wake up the next day and you don't know what happened, but you're worried, do not wait. Immediately go to an ER if you don't have a choice and that's the closest thing to you, or reach out to Valley AIDS Council immediately and get an appointment and you'll be seen. They'll rush you through and tell them that you need PEP, P-exposure prophylaxis. It's this medication plus 2 other ones that you take for 28 days. And during those 28 days, yeah, your tummy might be a little upset because you're not used to taking these meds. But again, no major side effects, no major problems. 28 days of that medication, they'll test you before you started, and they'll test you afterwards, and they'll test you 30 days after you've done taking the meds. But it is so effective that we haven't had but 1 or 2 cases worldwide of anybody contracting HIV as long as they got on the medication within 28 hours. If you are low income, if you don't have insurance, call anyway, because we have, I used to work there. I'll give it away. I'm giving away their drugs. Call them. We have extra drugs on hand. We can also write to the manufacturer and say, hey, we need this emergency med, and you will get it. Don't let money or embarrassment stop you. There's nothing that the people at Valley AIDS Council have not heard. Nobody will be shocked. Tell them the truth, ask for what you need, and protect yourself. And in the long run, protect the community.
Absolutely. So what I'm going to do is I'm going to bring back the PowerPoint so we can share the screen real quick.
Okay. And we're going to wrap up on that really quickly so we can get to some questions and answers, because we really do want to hear from you all. So there's PrEP.
PrEP, the pill that he just shown. And then there's PEP.
I'll go back to zero discordant couples.
Sure.
So a zero discordant couple is where one person is positive and one person is negative. And as I mentioned, I've been with my partner for 33 years. No children except for 2 little hairy mutts that are back here barking occasionally. But we're a zero discordant couple. My partner's HIV positive, I'm HIV negative. I don't ever want to contract HIV, and he doesn't ever want to infect me with HIV. So he takes this medication daily, and he's undetectable. He cannot pass it to me or anybody else. If he has a car accident and he's bleeding and somebody comes and they put a tourniquet on him and they're holding it down to stop the bleeding, they don't have to worry. He can't infect them because he is undetectable. If I have unprotected sex with my husband of 33 years, I don't have to worry. But I am responsible for my own health and nobody else's. So I take care of myself, just like he takes care of himself. And that's what we ask that anybody who's positive does. And again, you need to get your kidneys tested, make sure that you're doing okay. When you come in, they test you for HIV and STIs, because the same thing that causes HIV causes syphilis, gonorrhea, chlamydia, herpes. Yeah. 1 out of every 4 of us has herpes, by the way. Congratulations. So it's all wrapped up in this one service every 3 months, and you have peace of mind. Which is really, really important.
And everything Oscar's talking about, we call that treatment as prevention.
The testing is free. The medication, if you can't afford it, is free or low cost. The medical visit, again, if you don't have money, we'll figure out a payment plan. $10 a month, we'll figure something out. Don't keep money or embarrassment or que va a decir la tía from keeping you from coming in and getting what you need to mature, to have families, to have a joyous life without ever fearing about this disease.
That's what we spoke about earlier about stigma. Stigma does play a big role.
Yeah.
And so who should get tested for HIV? If anybody's ever had sex with somebody and they didn't know their status, meaning whether they didn't know they were HIV positive or not, they should get tested. If anybody's ever shared needles for drug use or homemade tattoos or piercings or any of that sort, they should get tested for HIV. If a person's pregnant or planning a pregnancy, they should get tested for HIV. The CDC recommends that everyone that's sexually active from 13 to 64 get tested for HIV, and everyone older than 65 gets tested for hepatitis C virus.
If you know a 13-year-old who's sexually active, they don't need their parents' permission to come and get tested. They don't need their parents' permission to get a medical exam. If they are HIV positive, they will be encouraged to engage the family. We'll support them in that effort. We've never had that go wrong. But there's nothing stopping a 13-year-old from walking in and starting to take care of their own health. If they're old enough to have sex, they're old enough to take responsibility for it. We've already talked about getting tested and how important it is. The window period, it takes 3 months before the antibodies will show up. But so when you get tested, you can't have unprotected sex today and go get tested for HIV and think, okay, we came back negative, I don't have anything to worry about. It takes 3 months for the antibodies that are detected by these tests to show up. So you have to wait. If you want to get tested to eliminate people from the past, but the one from last night, you've got to wait 3 months, to make sure that you're free and clear. Condoms, of course, are fantastic. We recommend latex. If you're allergic to latex, then there's polyurethane. If you're one of those men who says, I don't like condoms, they're too tight, no me quedan, you don't know how blessed I think by God. You see, you can't see it, but I have a giant Yeti bottle with me. I guarantee you, I can put a condom over that. We have played games at retreats where we put condoms over people's heads. If you've been blessed in that way, please ask your partner to walk away while they still can walk. Again, HIV is preventable. We definitely have to prevent mother-to-child transmission. All women should get routinely tested for HIV if you're sexually active. Even if it's your husband, even if it's your best friend, your boyfriend, take care of yourself. HIV can become a treatable chronic disease, and you can live with it and die of old age. I have friends who were convinced they'd be dead by now, and they're like, oh shit, I spent all my money. What am I going to do now for the next 30 years? Well, que les manda, pero you don't have to worry about HIV. HIV patients are getting older due to living longer. PrEP and treatment, of course, has decreased new infections. I want to go back to COVID for a second. It's really important that people understand that the reason we're having this conversation about COVID and HIV is that folks who are low income, folks who tend to be people of color and discriminated against, experience racism and oppression, who live in marginalized communities like the South, are at high risk for both. So one of the things that we are seeing is that not only is meth impacting overdoses that have greatly increased during the pandemic, but 14 of those overdoses increased up by 42% because of meth use. But it's that same meth use that causes people to go out and take unnecessary risks for COVID-19. So be wary of both. I'll hope that border closings and city shutdowns will disrupt drug trafficking during the pandemic has vanished, as it's clear that the opposite is happening. Crystal meth, in particular, is readily available. We talked about this. Even though there's plunging revenue for services and little financial relief, people are still finding a way to access this drug. And unfortunately, for our people in the Valley, especially young men, straight and gay, when they've run out of money and the addiction is there, then comes the exploitation of people taking advantage of you selling your body in exchange for the drug. When you've gone that low, you can come back from it, but it gets even harder. So have empathy and support people who are experiencing this, but know that combination can be deadly because of COVID-19 first, and then meth secondly. COVID-19 and Latinos, and this is very, very important. As of November of this year, the United States experienced a record high for single-day new coronaviruses. Latinos again faced a heavier burden of the cases. Racial, ethnic COVID-19 disparities persist across the country. According to the New York Times on July 6, Latino and African-American residents of the United States have been 3 times as likely to become infected as their white neighbors, and Black and Latino people have been nearly twice as likely to die from the virus as white people. You have to ask yourself why. The most recent census data shows that Latinos make up 18.5% of the US population. Of the US population, according to the US Census. But not only are hospitalization rates of Latinos 4.1 times the rate than among whites, but they're 32.3% of the US COVID-19 deaths. So why is it that Latinos are 18.5% of the population, but we're dying at a rate of 32.3%, because of COVID-19? According to the new CDC data report from November 2020, health disparities, race, and Hispanic origin are all, things that make you at higher risk for HIV because of the way we live, the way we eat, the way we maintain our health. And the fact that, again, many of us are so low income means less access to healthcare, greater impact of those other illnesses that, when combined with COVID-19, become deadly. Some regions of Texas with the highest mortality rates are predominantly Hispanic. Hidalgo and Cameron counties, both along the state's southern border, as well as El Paso, have seen death tolls that rival larger and more urban parts of the state, like Dallas and San Antonio, according to data from the Texas Department of Health. And this is the percentage of coronavirus deaths by race and ethnicity. You see Hispanics, that's deaths, and the population in Texas. So Hispanics in Texas are 39.6% of the population, but 48.8% of the deaths. Whites are 41% of the population, but only 34% of the deaths. Blacks, 11.9% of the population, 13.8% of the deaths. Asians fare better than anybody else, and even better than whoever other is. And one of the things that's driving the infection is the nature that COVID-19 recession has impacted the recession has been a double whammy for Latinos and Latino workers. First, Latino workers are disproportionately concentrated in industries that more deeply are impacted by recessions, such as restaurants, hotels, construction. Second, they're underrepresented in the industries least impacted, such as finance, telecom, information. The racial gap in the unemployment rate has nearly tripled since the beginning of COVID. And you can see there on the graph, the unemployment rate, hold on, we're gonna move this so that I can see it. The unemployment rate in the darker blue color is that of Latinos, and the unemployment rate of our white counterparts is lower. We're all suffering through COVID and its impact on the economy and everything else, but some are struggling more than others, and we just need to be conscious of it. We're gonna be wrapping this up so we can go ahead and get to you all and your questions. But please know that you can reach out to Poderosos at poderosos.org for information. If you ever want to volunteer, do some what do you call it? Some work as a student, we'd be glad to work with you. If you need help, advice, counseling, we're here to support you. Valley AIDS Council is the only AIDS organization in the Valley for 1.2 million people. Now that is fucking ridiculous. Excuse my French. But that 1.2 million people only have one AIDS organization in the whole region is extremely unfortunate. But they do a fantastic job. They have over 100 plus employees, 3 clinics, and they'll take care of you. There's their number. You can reach out to Armando individually. It's just reach out, ask to get tested, walk in and ask for an HIV test. They'll take care of you. So can somebody tell us what the questions might be? And we're this will be available right now, but you also get it at the end, and it's being recorded. So you can see the rest of the videos if you want to, where it says at the bottom, Sin Vergüenza, Altamed's award-winning telenovela.
Okay, hi Oscar, it's Elizabeth, can you hear me?
Hey Elizabeth, yes, I recognize your lovely voice.
Well, thank you for your presentation. We have about 10 to 11 minutes, and you did answer quite a bit for us, but here are some that kind of stuck out. You did mention that people under 18 can get tested as young as 13, but where would they be able to go? Can they go to any doctor's office, or would they
can go into Planned Parenthood, Clínica Esperanza, what's one down the street?
Was Valley AIDS Council?
Valley AIDS Council. Any public health entity will provide you with a test. If you have a relationship with your doctor and you can afford the copay and you have insurance and you're 13, 14 years old, walk on in. He has the right to test you.
Yeah, if it was to Google HIV testing or STI testing, it'll give them locations where to go in the Valley or nearest to them.
And I would say because of our young people and their high risk for HIV, those of you, especially as you get older, or if you're already in a position of power because of age or affiliations, we need to start pressuring our school district to start teaching comprehensive sex education again. There's no reason for unwanted pregnancies. A teenage girl who has an unwanted pregnancy is destined, unless she comes from a wealthy family, to go into poverty. And that one instance of an unwanted pregnancy will cause the next 3 generations of women in her family to be stuck in poverty. It takes that many years to get out of it because of one unwanted pregnancy when you're low income. So there's no reason for it. And we can prevent it simply by teaching people. We're not talking about abortion. We're talking about education for everybody. And while you're at it, let's teach them about HIV, because again, there's no reason for anyone to die of this disease if we can prevent it through pills and through education.
Okay, let's go to the next question. So you had mentioned that babies can be born with HIV. And they had asked, is there any way that a baby can be born without HIV if the mom had it?
Yeah, so if the mom has it, in many cases, a child will test positive for HIV upon birth. But we'll keep testing the child every few months, because when a child is born, they have their mother's immune system. And if the mother's HIV positive and she wasn't taking medication, then she's not virally suppressed. The baby will have the mother's immune system and will test positive. But if she starts taking the medication while she's pregnant for HIV and becomes undetectable during the 9-month pregnancy or the 8 months of the pregnancy, sometimes sooner, within 3 months in some cases, somebody can become undetectable. Then within a few months, that baby it'll show that that baby has developed its own immune system, and its immune system is that of being HIV negative, and everybody celebrates.
Yeah, and at that point, the baby will have less than 1% chance of being born positive for HIV. So that's remarkable.
So even if somebody is pregnant and positive, it's not too late to start the medication to save the baby from a lifetime of this illness.
Okay, and if the baby is born positive, does that baby then have to be on medication all of their life, or what do you all know about that?
So if after the 3 months we find out that the baby's immune system still comes back showing that they're positive, yeah, they're going to be on medication for the rest of their life.
Okay, but if they're on the pill, then they'll have a normal life. I mean, aside from taking
the
pill?
babies?
Yes.
They will, but because their bodies are so tiny and their organs are barely forming, medications are very harsh. So there can be side effects for infants. They're not horrific, but I wouldn't want to put a child through that if I can avoid it.
Not only that, they're going to have to live with the stigma of being HIV positive for the rest of their life also. So that's going to be a struggle for them.
I know a 21-year-old heterosexual young man who's brilliant, pianist, etc., and he's HIV positive, and he got it from his mom. You can't tell, except that maybe he's a little shorter, thinner, but I mean, he can kick ass and he's amazing. But whenever he tells somebody he's positive, everybody assumes that he's gay. And then he's got to deal with both the stigma of HIV and the homophobia that's been imposed on him.
Understand. Okay, so then here's another great question for you. They had asked how often, if someone is sexually active, how often should they be getting tested?
As I mentioned earlier, if you're sexually active, we recommend every 6 months you come in for an HIV test and an STI screening. They'll ask you lots of questions. It takes about 30 minutes in and out, more or less, depending on what you tell them. And you'll get all those tests, herpes, gonorrhea, chlamydia, syphilis of the throat, syphilis of the anus. They'll check you for everything. You do those things yourself, by the way. Nobody's going to impose themselves on you. And you'll get an HIV test. If you are really, really sexually active, or you have multiple partners and you don't know them well enough to know their status, or can't remember who they are, then please come in every 3 months. We've had people come in every month. We're not going to no health agency will ever turn you away. If you want to get tested, we will test you. Now, if you've gotten a little bit batty and you've convinced you have it and we have convinced you that you don't, that's a whole other conversation. But if you want to get tested, you will get tested.
Okay, and then here's another question. Between demographics, are the HIV symptoms different between men and women? And then also, is it different for people ages 40 years and older? Like, or is it worse for them because they're older?
Everything's worse for you when you're older. Trust me. No, coming back from an illness, especially if you didn't know you had it and you start to notice it because you're ill, is going to be harder on an older person. Between male and female, and those of us who are older, the medications seem to work well without much side effects or whatever. If this had been, if you were asking me this 8 years ago or 20 years ago, it'd be very different because the medications were very toxic, but they're not. In terms of the, how they feel, the symptoms, things of that nature, I've heard it affecting menstrual cycles and things of that nature, but to be honest, I haven't seen anything that says that a male body or a female body will have different sort of
like symptoms, signs or symptoms, or even side effects from the medications. I've really
no, from the infection is what they're saying.
Oh, okay.
Yeah, no, from the infection, we have rarely seen anything like that.
Okay, great. I think I have a question more so that I've thought of. What about people that live in like really rural areas, that they don't live somewhere that has, I guess, clinics very close by? Like
Los Fresnos? No, I'm kidding. I mean, we are considered a rural community. Imagine living in Los Fresnos, wanting an HIV test, and the closest place is Valley AIDS Council in Harlingen, and you don't have a car. Mass transit is not available here. After COVID is over, this team of folks will be out testing people in the community, at bars, at cantinas, alleys, wherever people gather, they'll be around. If you want to get tested, but you can't come in and you really are worried, call. You have Armando's contact information. Call him. He's such a head honcho now. He can pull some strings and see who can go get you tested. It'll be easier after COVID, but it's not impossible now.
Right.
Peace of mind is everything. So if you're concerned, reach out, please.
That's a great question. That's why we do our outreach efforts, and we go out to those rural communities and get to those people that don't have the means to come in and get tested.
But if you live near any kind of public health clinic, they do HIV testing too. They may not do it as well as these two folks in front of you, but they do it. So you can reach out to them and get their services.
Yeah, usually if somebody was to test positive, they'll refer them to us, and then
whether you test positive in jail, a hospital, a clinic, whatever, you'll end up at Valley AIDS Council because they'll help you with housing, with food, with counseling to keep you healthy, keep you on your meds for your sake and the community's sake.
Absolutely.
Okay, then we'll end on this last question. You mentioned a little bit, but besides Valley AIDS Council, are there any other local organizations that students or people of the community can volunteer their time to help spread awareness about HIV?
There's so many. From the Esperanza Clinic.
Yeah, Access Esperanza.
Access Esperanza. Planned Parenthood. Valley AIDS Council. Poderosos. There's the Transgender Health Network. If you are really passionate about working with our trans community, there's the South Texas Equality Project, which I will always take credit for having created, which deals with creating gay pride and celebrating the diversity of the Valley. And every year we would put on a giant pride event. First year, 300 people. The last year I was there, we had 15,000 people show up with a priest blessing everybody who was crying because the priest was blessing them. It's a phenomenal thing. And it takes a year to plan. So as soon as COVID is over, that's something you'd be interested in. That's another entity that could use your help. But you can come to us and say, I have no skills. We'll find something for you to do. You can come to us and say, I'm a fantastic writer. Well, honey, you're going to start writing grants for me. We'll figure out a fit for you. And if you can't figure out which one's the best fit, reach out to either one of us and we'll plug you in.
Okay, great. Well, I think that's all the time that we have for the evening. Do you all have any closing remarks that you would like to say?
I don't really have any. I guess if anybody is out there watching this and they need to get tested, they need condoms, or they just need information on sexual health, reach out to the Valley AIDS Council. You can go on Google, just type in Valley AIDS Council or valleyaids.org, and it'll go right to our website and you can get our information or contact information from there.
I would say follow Valley AIDS and follow Poderosos on Twitter, on Instagram, on Facebook, please. You'll get updates on all sorts of other things. I would say, first and foremost, I look a lot thinner in person. Secondly, that I've lost hundreds of friends in my lifetime, starting in the 80s and even 2 years ago, needlessly. In the 80s, maybe they didn't have a choice. We all have choices now. There's no reason for any of you to ever lose a loved one, or to risk losing your own lives. As young adults and adults in general, we have the means to protect ourselves. Do so. And regarding crystal meth, as I was saying, and its addictiveness and all that, just put the word out that it's all over the valley. Young people are experimenting with it, both gay and straight, and it leads to some really dangerous consequences. It is such an issue here in the valley that our friends at Vice News reached out and are wanting to come down and do a documentary early next year about meth in the valley. It's great exposure. It hopefully will bring in some money, but it's also so damn upsetting that we even have to have these conversations. So be good to yourselves. Love yourselves, because who else will? And just know how much each of us are worth. We're brown, different shades of it, and some of you there are brown as well. Some of you are maybe Caucasian. We're all in this together, but let's lift ourselves up and lift the valley, please. That's the only way we're going to move past this. And for now, 6 feet distance, maybe 13, as they're saying.
Wear masks.
Wear masks, please. And watch out for abuelita and abuelito and your tios and all that. You can bounce back perhaps, even though some haven't, but it's harder for them. So if not for you, do it for someone you love. Thank you all for having us.
Yes, thank you so much, Armando and Oscar. This was an extremely great event. And on behalf of South Texas College of Biology Department, we're going to ask everyone, just please make sure that you do subscribe so that you can see the rest of the videos that we're going to be putting out for you. And then if you have a few minutes, if you could take the survey, we'd love to hear your feedback. If there's something that you would like for us to work on so that we can present a new event to you, we will do that. So please take some time to fill out that survey, subscribe to our channel, and we're going to end it with that. We thank you for your time and for your patience, of course, and we will see you guys next time. Bye, everyone.
Stay safe.